قال الله تعالى: أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. يؤتي الحكمة من يشاء، ومن يؤت الحكمة فقد أوتي خيرا كثيرا، وما يذكر إلا أولو الألباب. صدق الله العظيم. I welcome all of you to today's lecture organized by Hikmat Society for Philosophy and Dialogue, where we'll be hosting Professor Dr. Yusuf Amin. Before we talk about our speaker for today, I would like to briefly introduce what Hikmat Society is about. It's a Hikmat Society. The full name goes as Hikmat Society for Philosophy and Dialogue, and it's a students' initiative. It's a student society and a students' initiative that promotes philosophy and dialogue among students. And the word hikmah or hikmat as is the Persianate version of the term, points to philosophy in a broader sense as understood in the Islamic tradition, and dialogue for us refers to interaction with different philosophies and philosophical aspects of other disciplines and other intellectual traditions. So mainly the objectives of the forum are to approach philosophy and related disciplines from a traditional Islamic perspective, to expose students to Islamic philosophy and philosophical themes and disciplines in the Islamic intellectual tradition, and in harmony with the Quran and the teachings of the Prophet sallallahu alaihi wasallam, while appreciating the boundaries set by the Sharia and the Word of God, and acknowledging the limits of human knowledge and the epistemological sources uh, provided by Islam and uh, by the revelation. To encourage proper philosophical thinking and intellectual debate and intellectual dialogue, as I already mentioned, to connect students with the Islamic intellectual and philosophical tradition and make them a part of it. More essentially, to help students reconcile their worldviews, that is, to deal with the dilemma of having conflicting worldviews emerging from secular academics and religious beliefs. So we want to create a bridge between the worldviews, and we don't want our students to have that conflicting worldview, one worldview at the workplace and one worldview uh, in the masjid. But we want a streamlined worldview, one worldview that approaches all aspects of reality that classically we used to have. And to discuss new developments in Islamic philosophy is also an important thing that we will be focusing on. To come to today's session, we will be hosting, and we are very glad to have with us uh, Professor Dr. Kunwar Muhammad Yusuf Amin. He is an MBBS and MD, and he's a retired professor of pharmacology, and he's also the director of Philosophy Science Forum at Aligarh Muslim University, India. And in the same university, he taught at the Faculty of Unani Medicine for 40 years and supervised research on more than 100 Unani treatments. Apart from this professional sphere of Dr. Yusuf Amin's life, is also an exponent of traditional philosophy, especially Islamic philosophy, but he also correlates it with and is interested with other traditional philosophies like the Hindu, Christian, Taoist, and Neoplatonic philosophy. And he is also an expert and has keen interest in Islamic religious sciences. What makes Professor Yusuf Amin more suited for today's talk is his expertise in both modern medicine and Unani medicine. Since I mentioned that Professor Yusuf Amin is actually a professor of pharmacology, he has an MD in modern medicine, but he taught in the Faculty of Unani medicine. So he has the first-hand expertise of both the fields. The reason why we selected today's topic is because we seem to have there seems to be a conflict between traditional medicine and modern medicine.
ये वो है ऐसे चल रहा है वीडियो और ये क्या कहते हैं वर्कशॉप टाइप का है 1-2 दिन का नहीं नहीं
Could you please
लाइव
turn off your mic,
हाँ
brother Adab?
रिकॉर्डेड नहीं है
Sorry for the interruption. So as I was mentioning, the significance of today's topic is that I would like to welcome Professor Yusuf Amin first of all. He has joined us from Aligarh. And coming back to what I was mentioning, that the significance of today's talk is we find people seeing traditional medicine and modern medicine, like people who practice modern medicine look at Unani medicine as a pseudoscience or even traditional medicines, and people who rely on Unani medicine, they tend to look at modern medicine again through different views. But we try to understand these medicines mostly by their practices. But in order to understand something very deeply, we ought to understand the philosophies that are underlying, because any knowledge has a substructure, be it the subjects of social sciences or natural sciences. When you go to study them, if you truly want to understand the nature of these sciences, you have to go deep into the substructure, which is the philosophy of that. So here we will be, inshallah, exploring the philosophies of both Unani and modern medicine, and then we should also proceed to how these philosophies shape the healthcare that these two systems offer, and what are their epistemological bases, and what are the theories that these medicines are based on. And there is a special reason that we took Unani medicine to uh, compare it with apologies, with the modern medicine. That's because of the holistic nature of Unani medicine, which Dr. Yusuf Amin will enlighten us more about it in detail. So I'll not take much of your time, and I request Professor Yusuf Amin to please start his lecture, and I'll be sharing his slide shortly. Thank you very much.
Assalamu alaikum. I hope I am both visible and audible.
Yes, the camera is fine and the audio is fine. Thank you. Please proceed.
Okay. Assalamu alaikum wa rahmatullahi wa barakatuhu. I am very happy that I have this opportunity to submit a talk on this topic, which is the healthcare and philosophy of Unani and modern medicine, a comparative analysis. The implications of this topic, I don't want to discuss separately. They'll come in connection with various observations, which I will be making during this talk. I think I'll be speaking for about 40 minutes, and then we will be having a discussion for about 30 minutes. So I'll request the esteemed participants to please jot down the questions or points which may come to their mind during the talk, so that they can be dealt with later on. May I have the next slide, please? Okay. Now, the first thing which we should note is that Unani medicine and other traditional medicines, rational and systematic traditional medicines like Ayurveda and traditional Chinese medicine, etc., have been recognized by the WHO as effective alternative medicines. So right from the beginning, it should be clear in our minds that they are effective medicines, and as such, they are a description of reality. They mirror reality, of course, from a particular perspective, which is different from the perspective of modern medicine. Our reality is very rich and complex, as all of us understand. So there is a different perspective, but Unani medicine and other traditional medicines, they very much reflect reality. They are real, they are objective. There's nothing metaphorical about them. Now, another important point to be noted is that for the last about 200 years, the world is following under the name of science, the modern Western sciences. But before that, all civilizations had their own traditional sciences. However, for various reasons, those traditional sciences have become now only of historical interest. Even that way, they are an important, valuable mine of information and insights, but practically they are of historical interest. And it is only a few traditional medicines like Unani medicine, Ayurveda, and traditional Chinese medicine, which are living traditional sciences. The sciences as they prevailed in the entire world and in all civilizations before the impact of the West. So this is again a very important point to note, that the traditional medicines, particularly Unani medicine, are the only living traditional sciences. So naturally, they are very valuable, and they have very important practical and intellectual uh, riches within them. Now, the what I have called as philosophy, they are made up of two things. Firstly, they include the self-declared principles of Unani medicine, and it also includes an analyzed substructure which works behind the Unani medicine. So by philosophy, we mean both the self-declared principles of Unani medicine, declared by the Unani medicine itself, as well as the substructure which has been teased out and analyzed by outside observers. So both of them are included in philosophy without indicating which is which. Now, this philosophy of Unani medicine in this sense is novel, as we will go ahead in trying to describe them. I'm sure all the delegates will be quite surprised that these are very different things. So they are novel, and their novelty mainly lies in the fact that they are based upon the supramaterial level of man. Modern medicine, as all of us know, it is based upon only the body, and in the body, the molecules are taken to be fundamental. So some people even call it biomolecular medicine, because the molecules are considered to be fundamental to both human reality as well as to the reality of drugs. Whereas in Unani medicine and other traditional medicines, all traditional medicines, the supramaterial level of man and supramaterial level of treatments is used as foundational, is used as fundamental, and there's a clear reason for that. The reason is that human beings and drugs, they exist as a unity. They exist ontologically as a unity, objectively as a unity, only at the supramaterial level. As soon as their material level starts, as we come down to their material level, there is multiplicity and differentiation. So because these medicines wish to be holistic, it is very logical that they should base themselves upon the supramaterial level of man, where alone man objectively exists as a unity and can be studied and observed as a whole. Rather than being created into a fictitious, being created into a pseudo whole by adding up, by summing up the various components which have been found by empirical study, etc. As some people are trying to do these days, they call it systems approach, or they call it omics, proteomics and metabolomics and genomics, etc., etc. But these are all pseudo wholes. They are not the real wholes, because they are just the summation of various bits and pieces which have been discovered by empirical study. And then there is the question of the relation, how many of the bits and pieces may not have been discovered, and they may not have been arranged in the way they are arranged in nature. So these systems approach, systems biology and omics, these are pseudo wholes. The real whole can be achieved only when we approach man at his, man or women at their supramaterial level, where they objectively exist as a unity. So this is the tremendous novelty of Unani medicine and all traditional medicines. Now, this aspect or this character of traditional medicines, that is basing themselves on the study of the supramaterial level, and they're studying man as a whole, and then of course going down to the differentiated level also, but the basic framework is that of studying man as a whole and drugs as a whole. This calls for a major shift in academic philosophy. In our philosophy departments, our notion of philosophy is positivistic. It is based upon empirical study. Generalizations are made, but they are derived from empirical studies, mainly from empirical studies. So this novelty of traditional medicines, which approach man at the supramaterial level, and yet they work, which clearly shows that they are reflecting reality. This is not mumbo jumbo. This is not a hocus pocus. It reflects reality, because when treatment is undertaken on the basis of their schemes, it always works. And it does not work only in the described diseases, in the new diseases. In the last 40 years, I'm aware of certain attempts to find out the Unani medicines for new diseases like AIDS or corona infection, etc., etc. And always they met with success. So, this shows that it is these traditional medicines are a reflection of reality. So if we square the two things up, the fact comes out that there is a supramaterial level to reality. And this calls for a major shift in the academic philosophy. And it also supports the traditional philosophies, because the traditional philosophies, whether it is Islamic traditional philosophy or Hindu traditional philosophy or Christian traditional philosophy, pre-Renaissance Christian traditional philosophy, or Taoist traditional philosophy, or the ancient philosophies which are still with us, like the ancient Greek philosophy, the Neoplatonic philosophy, all these traditional philosophies, they base themselves on the supramaterial level. The material level is seen as an extension and dependence upon the supramaterial level. So in this way, Unani medicine provides a support for the traditional philosophies. Now, it has been decided with the hosts that the philosophical implications of Unani medicine will be discussed in a separate and independent lecture, which inshallah we will be undertaking later on. May I have the next slide, please? Now here we begin with healthcare, and this is a macro comparison of healthcare of Unani medicine and modern medicine. The most important thing is that Unani medicine treats the basic imbalance which underlies a disease. For Unani medicine, there is a basic imbalance behind every disease. And it is this basic imbalance which has to be discovered and which has to be treated in order to not only give root cure, but also undertake a safe treatment. Safety of treatment also depends upon identifying the basic imbalance behind a disease and treating it. I don't have the time to show how safety also flows from basic imbalance, from discovering basic imbalance and treating the basic imbalance. But as far as the efficacy is concerned, it is so easy to understand that we can achieve root cure or radical cure only if we identify and treat the basic imbalance behind the disease. But at the same time, Unani medicine also treats symptoms. It has a complex treatment. The basic treatment is for correcting the basic imbalance, but then there are secondary drugs and other means for improving the symptoms also. For example, let's take the case of hypertension, which is commonly known as high blood pressure. Now, according to Unani medicine, the basic imbalance involved in hypertension is increased dry. Soon we will see that Unani medicine describes the supramaterial states with the help of 4 qualities: hot, cold, dry, and wet. And the proportion and ratio of this keeps on changing. So in hypertension, according to Unani medicine, the basic imbalance is that the dry becomes abnormally increased. So naturally, the treatment lies in administering a wet drug. There's a mistake in my slide. I have mentioned a cold drug. It should be wet drug. So a drug which is predominantly wet should be given. So it will take care of the increased dryness of hypertension. And in this way, the basic imbalance behind hypertension or underlying hypertension will be treated. But sometimes hypertensives may also suffer from headache. So Unani medicine will also give them painkillers for that purpose. So Unani medicine mainly identifies and treats the basic imbalance in terms of the 4 qualities or kafiyat of hot, cold, dry, and wet, various ratios of these 4 qualities, but it also gives symptomatic treatment. As I've already submitted, the benefit of treating the basic imbalance underlying a disease is that on the one side, we achieve root cure or radical cure. And on the other side, there are no side effects, no adverse effects. Now, coming to the second point in Unani healthcare, the issue of diagnosis. Unani medicine uses clinical signs and symptoms for making its diagnosis, whereas all of us know that modern medicine mainly uses the laboratory investigations for making the diagnosis, but Unani medicine makes the diagnosis on the basis of the signs and symptoms seen in a person. And the result is that this type of healthcare, it results in that this treatment is holistic, which is obvious, but it is also effective, it's also safe, and it is cheap, because the diagnosis is does not involve financial input. Diagnosis, it involves a lot of hard work, in the sense that developing these subjective skills is not an easy job, and a tabib or hakim devotes his or her lifetime to develop that skill. But once that skill is developed, no money is involved in using those skills and diagnosing the disease in terms of with the help of clinical science. And the result is that Unani healthcare is holistic, it is effective, it is safe, and it is cheap. On the other hand, modern medicine treats the symptoms of the disease. It treats the symptoms of the disease, what is showing as a disease, it treats that, and it treats that mainly by acting at the level of the molecule which underlies that particular symptom. For example, in case of hypertension, according to modern medicine, one of the major causes of hypertension is that the blood vessels, they become constricted, their diameter becomes reduced. And constriction is produced by the activity of a particular molecule, which is called alpha adrenoceptor. So modern medicine would give a drug which blocks or which stops the activity of alpha adrenoceptor, and thereby it will do away with the constriction. And when the blood vessel will become wide again, then the blood pressure will decrease. So this is the basic fundamental of healthcare of modern medicine, that is to treat the symptoms, which means the disease as it appears, and to treat the symptoms by acting at the level of the molecules which are at the basis of the development of that particular symptom. So that I've tried to illustrate by means of this example. Now, the result of this type of treatment is that there is symptomatic relief. There's no assurance of the disease process being done away with, the underlying disease process of being done away with. Rather, there is symptomatic relief. That's why either there is lifelong treatment in case of hypertension or diabetes, etc., or the person becomes naturally healthy again. And till that occurs, this particular treatment of Western medicine takes care. So there is symptomatic relief. The disease process itself is not done away with. And as a result, either there is lifelong treatment or treatment till the person gets a natural cure. And secondly, there are very serious side effects. Although this is a much appreciated issue, the serious side effects of Western medicine, but I think it is so horrendous. These side effects are so terrible that something on every such occasion when we discuss this medicine, we should talk of the terrible side effects. In one case, a lady suffering from rheumatoid arthritis was being given painkillers, Now, these painkillers, they produce acidity. Then later on, some new painkillers were developed which did not produce acidity. So they were sold like hotcakes at great amount of with great amount of money. And these second generation painkillers, they did not produce the increased acidity, but after a year or two, it was realized that they produce a much more serious effect. They increase the chances of stroke and paralysis on the one hand, and heart attack and myocardial infarction on the other hand. And the lady of whom I'm talking, she developed a stroke, and she expired because of the stroke. So such anecdotes, as well as more systematic studies, they should be recounted to underline the very, very serious and terrible nature of the adverse effects which are involved in modern medicine. Now, coming to the diagnosis, as all of us know, it depends upon laboratory tests, not upon observation or touching or something like that. It depends upon laboratory tests. For example, the WHO recommends that if with a new case of hypertension, that patient should be tested for extensively tested for heart function by means of electrocardiogram and echocardiography, and which are very expensive procedures. Particularly echo is quite expensive, and many blood tests. Similarly, blood tests should be carried out for kidney function and for diabetes mellitus, because the coincidence of these diseases, they help us to choose the drug which should be given, because there are many drugs for treating hypertension, and a particular drug becomes preferable in the light of some coexisting diseases. So this very extensive laboratory testing should be carried out as recommended by WHO before starting the treatment of hypertension. So the result is that the improvement is partial. It is temporary, usually temporary, it is partial, and there are very serious side effects, and the treatment is expensive. Expensive is a understatement. Many times the treatment is exorbitant and beyond the reach of a person. So this is a very broad comparison of the healthcare of Unani medicine and modern medicine. May I have the next slide, please? Now we come to the comparison of the philosophy of Unani medicine and modern medicine. And as I had mentioned earlier, by philosophy, we mean both the self-declared principles as well as the external and objective analysis of the substructure lying behind the practices and thoughts and ideas of these medicines. Both are included under philosophy. So the first thing to be noted is that Unani medicine considers both the disease and the treatment holistically. As we have already seen, that the disease, in the case of disease, it is the basic imbalance which is focused upon. Of course, symptoms are also noted and treated, but the emphasis is on identifying and treating the basic imbalance. So the disease is a holistic thing which affects the whole human organism. Similarly, treatment should also be holistic. It should not take part of only one or other symptom. Rather, the treatment should by correcting the basic imbalance, it should produce a holistic improvement. So this is the first and most basic principle of the philosophy of Unani medicine, that both the disease and the treatment should be holistic. By holistic is meant that the disease is there in the entire organism, and it should be eradicated from the entire organism. The treatment should be such. The second important philosophical assumption of Unani medicine is that man and drug exist as a unity only at the supramaterial level. This I have mentioned earlier also, so I will not dwell much upon it. But since Unani wants to be holistic, and since it realizes that man exists as a natural whole, as a natural unity only at the supramaterial level, therefore, the diagnosis of the disease and the selection of the treatment should be based upon a study of their supramaterial level. The assumption behind this is, of course, very revolutionary, that the reality is not only material, which is what, since the Renaissance, the modernity believes in, and this is what is current in the entire world, that only matter is real. The assumption in Unani medicine is that it is not only matter which makes up the reality, rather reality is multi-level. And at least we will have to divide the reality into 3 levels. There are various schemes, but at least into 3 levels. The corporeal level, or the physical or the material level. Then above that, the subtle level. And above that, the spiritual level. And then the roots of all these levels in divinity, in God. The roots of all these levels of reality are in God. So out of these 3 levels, only the corporeal level can be studied by sensory means. The subtle level, which is above it, and the spiritual level, which is still above it, and of course, the roots of all these 3 levels of reality in the divine, they cannot be studied by sensory means. They have got other methods. Most important is an intellectual intuition. Now we have to be very careful in using the word intuition, because at the present, by intuition, we only mean very low type of intuitions, which are basically of the nature of animal instincts or something like that. So this is not the intuition which is involved in the apprehension of supramaterial levels, the subtle level and the spiritual level, and their roots in the divinity. That is another type of intuition. We can call it intellectual intuition. We can call it spiritual intuition. That type of intuition is involved. Now, naturally, that type of intuition is not available to every person. Only great sages have that intuition, and it is they who have studied and they have documented the supramaterial level of man and of drugs and treatment, etc. But by the same intuitive powers, they have also found the sensory signs of these supramaterial states. They have intuited the supramaterial reality and the supramaterial states, but they have also intuited the sensory signs of those states. And present day physicians, they apprehend those states not by direct intuition, but by the sensory signs, which also had been found out or discovered by the sages. So this is the assumption that the reality is multi-level, at least corporeal, subtle, and spiritual, and then its roots in the divine. And the supramaterial level or its state is described in terms of 4 qualities: hot, cold, dry, and wet. And there's a particular ratio of these qualities, and which keeps on changing. And so the supramaterial states, the normal state, the abnormal state, or the supramaterial effect of the drug, all of these things are found in terms of these 4 qualities: hot, cold, dry, and wet. For example, we have seen that hypertension is considered to be a disease where the dry has increased. So it should involve the use of a drug which is wet. So this is one example which will help us in understanding that that there is this assumption, philosophical assumption in Unani medicine, that the supramaterial states are described in terms of the relative preponderance of hot, cold, dry, and wet. And now these qualities, they have got sensory signs. And these sensory signs have, of course, they have been initially discovered by the sages, but the present day tabib has just to use these sensory signs and thereby apprehend the state of the supramaterial levels. Yet another stand of Unani medicine is that the human beings have got some qova or faculties, like the faculty of respiration, the faculty of digestion, the faculty of reproduction. So what in modern medicine is usually called the physiological system, the digestive system, the respiratory system, the reproductive system, Unani medicine says that actually these are some powers, these are some faculties, these are some qova. Qova is, as most of you can understand, is the plural of quvvat. So these are some quvvats which work, and they are real and objective, and they are known by their effects, and the effects are within our senses. We can see whether the digestion is good or not good. We can see that whether the respiration is regular or irregular. So it is these effects which are sensorily observable, that we are able to apprehend the changes in the working of the quvvats. So, but the quvvat per se, quvvat itself, it is again, it is knowable by intuition, by that high intellectual intuition, which is available only to great sages. Then Unani philosophy also holds that behind every disease there is a unified basic imbalance, a unified basic imbalance. For instance, in our example, we have seen that hypertension is basically an increase in the dry, which manifests as the various signs and symptoms of hypertension. Similarly, the primary drug effect, a drug may have many actions. Unani medicine describes even 50 actions in one drug. But the primary action, the primary effect of a drug is again is a unified thing from which the many actions arise. And this primary effect is again, it is in terms of the 4 qualities. Hot, cold, we say this is a cold drug, this is a wet drug, which means that the wet is predominant. So the disease is a unified basic imbalance, and the drugs, they have got a primary drug effect, and all their actions arise because of that primary drug effect, which is again described in terms of a predominant quality of hot, cold, or wet and dry. Now, coming to modern medicine, as all of us very clearly know, that it has a very partial approach to both disease as well as treatment. It looks upon hypertension simply in terms of 3 major things. Either there is increase in the constriction, which means that the blood vessel has become narrow, or it is due to increased volume of the blood, or it is due to increased output of blood from the heart because of more forceful pumping and because of greater heart rate, etc. So basically, these are 3 things: the constriction, blood vessel constriction, which increases the resistance, so resistance, then the plasma volume, and then the cardiac output, the amount of blood coming out of the heart in one beat, which depends upon the force of the contraction of the heart muscles. So these are the three things, which is all. Then it, just as in the Tongas, which have been driven by horses, just to keep the animal undistracted, some shades are put on the two sides of its eyes so that it can look only ahead. So in this way, modern medicine will now only look ahead at these three things, and it will ignore all other aspects of man, whether some changes are occurring in those aspects of man in hypertension or not. That will be totally ignored. It will focus only on these three things, that is resistance, increased plasma volume, and increased cardiac output. So from this illustration, I think we can appreciate that it is a bit antithetical to Unani medicine. It is very partial. And then accordingly, the treatment is also partial. It will just focus on decreasing the resistance or decreasing the cardiac output or decreasing the plasma volume, and that will be it. That will be the treatment. The second important philosophical aspect or assumption of modern medicine is that reality is only material. So that since there is no supramaterial level in man or in the drugs, so naturally there is no primary unity, because unity exists only at the supramaterial level. At the material level, a thing is differentiated into many components. So there can be no primary unity, and so there can be no true holism. They try to make up a pseudo-holism by adding up all the empirically known aspects, and they call it systems approach or omics nowadays. They call it omics. So, but that is not a true holism. The next philosophical idea in modern medicine is that the disease is equal to the sum of the symptoms. What we observe or what the patient feels, a summation of all those things, that's equal to disease. There is no other additional aspect to disease. Then the next important assumption is that molecules are fundamental. First assumption is that the body is the only thing in man. There is no other thing except body. Or in other words, only the reality is only material. In the case of man, material means body. But the body is made up of molecules. Molecules are the fundamentals of the body. So sometimes it is called micro-essentialism, that the micro substructure of the body is the real thing. It is the fundamental thing. So molecules are fundamental, and the molecules or the derangement in a particular molecule which is responsible for a symptom, that derangement in that particular molecule is modified by a drug which can modify the abnormality which has occurred in the biological molecule behind a symptom. The next important thing is that being only material, reality, and in the case of medicine, the reality is the patient's patient. The patient's reality is only the body. So it is best knowable by sensory measurements. Firstly, it should be only by sensory observation disease can be known. And in the case of sensory observations, the more exact and more correct sensory observation can be made only by means of measurements, not by means of a holistic sensory observation, but by means of measurements. For example, we assess the kidney function in terms of the concentration of urea or creatinine in the blood. We measure the heart function in terms of the electrocardiogram and the electrical patterns in it. Or we study diabetes mellitus by measuring the concentration of glucose in the blood. So it is the measurement of physical things which is the best way of knowing it and understanding it. So these are the philosophical assumptions of modern medicine. May I have the next slide, please? Now, I will briefly submit a little bit of Unani physiology and pharmacology. So according to Unani medicine, man, drugs, and every other thing in the universe, in the cosmos, everything is made up of 4 arkan or elements. These arkan are earth, water, fire, and air. And it is made clear right in the beginning that by air is not meant the physical air, but the supramaterial principle of air. And by earth is not meant the physical earth, but the supramaterial principle of earth. And similarly, by water is meant the supramaterial principle of water. So according to Unani medicine, all things are made up of particular combinations, ratios, and proportions of these 4 arkan or elements, and which are supramaterial. Their name appear to be physical, but they are actually supramaterial. They are not physical. The arkan, each rukn, because arkan is the plural of rukn, so each rukn is defined by kafiyat, 4 qualities: hot, cold, dry, and wet. For example, earth is cold and wet. It means that, earth will have all the 4 qualities, but the quality of cold and wet would be predominant. In case of water, the quality of cold and moist would be, earth will be cold and dry. There's a mistake in the slide. The earth is cold and dry. It means that the quality of cold and dry is predominant in earth, whereas water is cold and moist, and air is hot and moist, and fire is hot and dry. So each element is defined by the predominance of these 4 qualities, of 2 of these 4 qualities. I think we have gone back. Can we come back again to the? Yes. The second important thing is that each object in the universe, we have many objects. For example, we have human beings and we have horses. Then within human beings, we have races. We have the Africans, we have the Asians. And then within races, we have the individual X or individual Y. And similarly, in the case of drugs and plants and animals and minerals, we have objects. So each object is defined by the integrated kafiyat of ratio of arkan. Each object is made up of these 4 elements, but the ratio of these 4 elements is different from object to object, and it will always remain the same. And because each object has got certain qualities, so there will be a ratio of the qualities. Each object will be defined by a particular ratio of the 4 qualities: the extent of hot, the extent of cold, the extent of dry, and the extent of moist. This ratio of the 4 qualities in a particular object will define it, and it is this which is called mizaj, the very famous word mizaj, which is usually translated as temperament. Now, we have seen that hypertension is involves an increase in the dry. So Kahu, which is a wet drug, again, there is a mistake in the slide. It is cold also, but along with being cold, it is wet also. So Kahu is a Unani name for a particular seed. So Tukhme Kahu has predominance of wet. So it would be a useful drug in the treatment of hypertension. Now, since the abnormally increased kafiyat is the thing behind the disease, so it can be treated by using a substance which has got a predominance of the opposite kafiyat. So this is called ilaj bizid, which will give the relief. It will bring that abnormally increased quality in the human being back to the normal level by giving a substance of opposite quality. So, as I had mentioned earlier, newly arising diseases like AIDS or this corona infection, these newly arising diseases which were not with us, attempts have been made to treat them on the basis of this scheme. First, people have tried to find out what is the basic imbalance behind AIDS, and they came to the conclusion that the basic imbalance behind AIDS is increased cold. So the treatment would lie in using drugs which are hot, which have got increased heat. Things are much more complex than this, but this is the basic perimeter. Things are very complex, so other fine tuning is done on other basis, and then certain drugs were hypothesized that they will be effective in AIDS, but basically on this ilaj bizid, on this principle of ilaj bizid, of giving the opposite quality, of giving a drug of a quality which is opposite to the abnormally increased quality in the disease. And it was found in, I think, more than 90% of the cases that the drug worked in these newly arising diseases of AIDS and corona infection, etc. While preparing for a lecture, which unfortunately got indefinitely postponed, I collected references for all these, for a large number of these attempts which were made throughout India. So I collected the references because I have been a teacher over here in a Unani institution for 40 years, and there are a large number of my students, and through these students, I can communicate with other persons in various Unani institutions. So that way I collected the references of such researches which were carried out, where a drug was hypothesized, Unani drug was hypothesized for a new disease on the basis of this misaj, and then it was empirically found to work in that particular disease. As I have said, I think 2 or 3 or 4 times earlier also, that these principles of Unani medicine, they reflect reality, because they work when a hypothesis is made and the intervention is done on the basis of that hypothesis. That intervention or treatment works. This shows that these schemes of Unani medicine of hot, cold, dry, and wet, they reflect reality. And from this, we can secondarily derive that supramaterial level exists, because all these schemes, they are based upon supramaterial existence. So supramaterial existence, the supramaterial level exists, and that intuition of the sages can grasp that supramaterial level. That is also secondarily validated by the fact that Unani drugs hypothesized on the basis of Unani schemes in the perspective of supra-material level and in the perspective of intuition, intellectual intuition, grasping that supra-material level. Since these hypothesized drugs, they work in new diseases, so all of them get supported. May I have the next, please? Next slide, please.
It's already here.
Yes. Thank you. Now, one wonderful scheme of the levels of being in Islamic traditional philosophy is called Al-Hazirat Al-Ilahiyya Al-Khams. So according to this scheme, there's a very nice chapter. There's a very nice monograph or article on this scheme by Fritjof Schwann under the title of Five Divine Presences in his book, whose title is Dimensions of Islam. So there's a very nice description of Al-Haziratul Ilahi Al-Khams. According to this scheme, reality is made up of 5 levels. The first level is the Nasut. In English, we will call it the corporeal level. Now, we are unfortunately accustomed to using physical or material, but if we use words with the intellectual rigor, then it is not proper to use physical or material. Rather, the best word for using for that level of reality which we encompass by our 5 senses is corporeal. So Nasut is corporeal. And in the case of Unani medicine, that part of human being which is corporeal is called Aza. Aza, as you know, is the plural of Uzv, which means organ. So Aza means organs, but basically it means the physical body. So at the level of Nasut, there is, in the case of man, there is physical body. Now these 5 levels are present in every object. Human beings, animals, even a very small pebble lying on a beach has got all these 5 levels. So the first or corporeal level or physical or material level is Nasut. And in the case of man, this comprises the Aza or the physical body. Then there is the Malkut. The Malkut is subtle. Now these are ideas which contemporary people have totally lost because of the domination of the materialistic worldview of the West. So if we want to again gain an idea of what we mean by subtle, we can think of the jinn. We know the jinns, and the Muslims believe in jinns, and people of other religions believe some in other corresponding entities which are like jinns. So jinns are subtle. So I have used this example just to restore the concept of the subtle, because nowadays we have simply lost. By subtle, we simply mean things which can vaporize. At the physical level, subtlety of things which can get vaporized, like camphor, or this we call as subtle. But subtle basically it means it's a supra-physical, supra-corporeal level of being or existence, which is called subtle. And for that, we can restore the idea by thinking of the jinns. Now, in human beings, at the subtle level, there are the arwah. So arwah is the plural of ruh. And in English, we have the term pneuma for it. Now, Unani scholars, right at the beginning, they make it clear that by ruh, they do not mean that ruh which is mentioned in the religious sense in the Holy Quran, but rather they mean some subtle substance. That's what they mean by the ruh. So this is again a problem in traditional philosophy, that the same term is used for different things. And by some transposition, it is used for different things. And it is the context which makes it clear in which meaning a particular term is being used. So this ruh, whose plural is arwah, because man is considered to have 3 ruhs or 3 arwah. So this is a subtle substance, and the English word for is pneuma. And a similar thing is there in traditional Chinese medicine, which is called qi, which is usually written as qi. This is a subtle energy, according to traditional Chinese medicine, which keeps running through the vessels in the human body, and it is the blockade in these vessels which do not allow the free distribution of this qi that is behind the diseases. This is the idea in traditional Chinese medicine. So I've mentioned it just so that we can get a good concept of what we mean by subtle and what we mean by the subtle component of man according to Unani medicine, which is called arwah, or three roots. Then the next level of existence is Jabrut. Jabrut is the spiritual level. And at this level, the Unani components are the arkan, elements. We have just talked of the elements. So elements, basically, we have seen that they are not physical things, although they are named after four physical things, but they themselves are not exactly those physical things. So the question is what they are. If they are not physical or corporeal, what they are? Then they belong to the realm of Jabrut, or they are spiritual in their ontology. Another component of man, of which we have already talked, is quwa, which is a plural of quwwat, which means faculties like the quwwat of digestion, the quwwat of respiration, the quwwat of circulation, the quwwat of reproduction. So these quwa are also ontologically, they are of the spiritual level. Then above the spiritual, above the Jabrut, is the Lahut, which is the celestial level. Now, this celestial level, the component in man, which is present, which is at this celestial level, because as I have said, that according to traditional philosophy, traditional Islamic philosophy, all objects in the universe, whether it's a small pebble or human being, they are made up of all these five levels of existence, not only matter. So in human beings, this lahut is expressed in the form of tabiyat. You must have heard a lot that in Unani medicine, each human being is considered to have a tabiyat, and it is this tabiyat which cures man internally. And it is the Greek word for it is physis. Then, of course, the ultimate level of existence or wujud or being is hahut. And this hahut, corresponding to hahut in human beings, there is the root of nafse natiqa. Unani medicine talks of nafse natiqa, and it uses and it says that nafse natiqa is its term for the religious ruh. Whatever is meant by ruh in the theological sciences, in the revelation, that for that level of for that level of reality, Unani medicine uses the term which is present in man. It uses the term of nafse natiqa. So nafse natiqa, the roots of nafse natiqa, to be more precise, they exist at the level of hahut, which is the ultimate level. And the theological term for hahut is zat-e khudavandi. That is the theological correlative of hahut. Now, as I had said earlier, this is beautifully described. It's a great service to humanity that Schuon has described this very important but complex scheme in very simple words in hardly 12 or 15 pages in his book Dimensions of Islam, in the chapter entitled Five Divine Presences. Now, this description of the five divine presences in Schuon, it fully supports Unani medicine. It makes Unani medicine and the components of man, according to Unani medicine, it makes them correctly comprehensible. It makes them correctly comprehensible, this description. But the positivist Western modern philosophy, if we try to see the Unani narration in the context of positivist Western modern philosophy rather than the multi-level existence and multi-level being, which I have just mentioned, who's one of the schemes I have just mentioned, then it is very easy to see that Unani gets subverted. When people, unfortunately, many Unani scholars also, because of the unconscious and unwitting hold of Western materialism, they tried to interpret the ruh in positivist terms, in physical terms. And they said by ruh is meant oxygen. Now, this is a very silly thing to say. At the most, we can say that oxygen supports the ruh. That's the most which can be said. But to equate the arwah of Unani medicine with oxygen is extremely silly, is absurd, because by definition, the arwah are supramaterial, they are spiritual, and oxygen is an out and out material and corporeal thing. So how can we interpret ruh as oxygen? But unfortunately, this is what happened at the beginning of the 20th century. And very unfortunately, many of the great Unani scholars also, they fell into this error and they wrongly interpreted the Unani terms, which related to supramaterial levels. They very wrongly and in a very absurd manner, they interpreted in terms of the physical level, although they belong to the supramaterial level. Now, this has really created havoc in Unani medicine. Now, in Unani medicine, a good number of people, they simply treat a drug like a quack. They simply treat a disease like a quack. If he has got arthritis, oh, Suranjan is the drug for it. If he has got hypertension, then Kahu is the drug for it. These are well-known drugs. But the real modulation and customization of a very proper treatment for the human disease, now it is totally out of their hands, because they cannot describe disease in Unani terms. They describe disease in Unani terms which have been misinterpreted materially. Who's one of the examples I have given to you, that they have claimed that by ruh is meant the oxygen. So this is something which is very bad, which has happened, and very otherwise very eminent Unani scholars, to whom we are very grateful for their service to Unani medicine, by maintaining Unani medicine as an actual method of treatment even in very bad days of British rule. So we are very respectful to them. But when they came to theory, they did a great disservice to Unani medicine by wrongly interpreting the supramaterial terms of Unani in the material terms. And that has subverted Unani medicine like anything. Then there is another well-known book that is Islamic Medicine by Alman. This is considered to be a very standard text in the, of course, Western scholarship. So he is intelligent enough to understand that by arkan or elements, something is meant which is not material. But that gentleman and the entire modern West, they simply do not have a notion of a substance that can be supramaterial. So what he has done, he has said that arkan are not material, they are abstract. Now you can see that what a great difference is there between abstract and between the supramaterial substance. So in this way, these limitations and shortcomings of Western scholarship, they have also led to the subversion of Unani medicine and traditional medicines in general. And the Unani medicine can be fully understood and practiced with all its power only when it is studied and understood in terms of the levels of being, whose one of the schemes is the 5 divine presences. Now coming to the next point, naturally, Unani medicine is a very sophisticated system. So for people who have no idea about it, we have to begin only with the barest of the sketches. So, but I want to give our participants some idea about the complexities involved also. Otherwise, we'll simply think that human beings are made of arkan, and arkan are described in terms of 4 qualities, and then they have got some arwa and they have got some quva. That's only part of the story. According to Unani medicine, the Unani medicine follows the Aristotelian model of hylomorphism, where each object is made up of 2 things. It is made up of a substance which is called hyli, and in Arabic it is called hiyula, and the other thing is the morphe or form, which is called surah in Arabic. So this is the Aristotelian approach to ontology, that every object is hylomorphic. It is made up of a particular substance and a particular form. And so one set of properties in that object arises because of its peculiar hyli, and the other set of properties arise because of its peculiar form. So the morphe part, or the form part, or the surah part in Unani medicine, it is associated with quva. Quva, which is a plural of quwwats. So there are various quwwats in a human being. Now these quwwats, they are the instruments of tabiyyat, and tabiyyat is an instrument of nafse natiqa. So now we have this hierarchy. Nafse natiqa is equated with the ruh in the religious sense, or the spirit. So there is the spirit. The spirit, one of the instruments of the spirit is the tabiyyat, and then the tabiyyat has got many quwwats, like the quwwat of digestion, quwwat of reproduction, etc. So this morphe part is the hyli part is made up of the 4 elements in particular proportions, but the morphe part is made up by the quwwats, and these quwwats are the instruments of tabiyyat, and tabiyyat is the instrument of nafse natiqa. And hold your breath, nafse natiqa is the instrument of mabda fayyas, the generous origin. It is called mabda fayyas, and this refers to that dimension of God through which God creates and maintains human physiology, and the not only human physiology, but the qualities and working of all things, whether they are animals or plants or minerals. So the nafse natiqa is an instrument of mabda fayyaz, the generous origin. And this is totally correlated with Islamic revelation and Islamic theology, because in the Quran it says, "A'udhu billahi minash shaitanir rajim." فَإِذَا سَوَّيْتُهُ, when God perfected the model of Adam by clay, فَنَفَخْتُ فِيهِ مِنْ رُوحِي, then we blew something from our spirit into it. So this is totally in consonance that with the Islamic theology, and of course with Islamic philosophy, which is based upon Islamic revelation, that the tabiyyat is an instrument of the spirit, and the spirit is an instrument of God. So that's how God is directly connected with human beings. God is directly connected with minerals. God is directly connected with plants and animals. So you can see the beauty of this very integral vision of reality. I think I can go to the next slide. Can I have the next slide, please? Now, coming to the issue of what is the benefit of understanding the philosophy of Unani medicine? Because I don't know why there is such a big animosity and hostility to this term philosophy in the modern age, that one has to bend over backwards to justify the study and use of philosophy. So I raise the question: what are the benefits of understanding Unani medicine philosophy? So these benefits can be divided into two: lower benefits and the higher benefits. So this is not mine. This classification of this division is not mine. It is a very basic division of universal metaphysics. So studying any science, any philosophy has got two types of benefits: a lower benefit and a higher benefit. The lower benefit is problem solving, whereas the higher benefit is the understanding of ultimate reality. So simultaneously, when we study anything, we have two benefits. One is the lower benefit, which is the ability to solve worldly problems. In this case, to give effective and safe treatments. But there are also higher benefits simultaneously, and that higher benefit is the understanding of ultimate reality, which is called in our theology as marifat. And the English word for marifat is gnosis. So these are the two benefits. So the lower problem solving benefit, which we will get by studying the philosophy of Unani medicine, will help in the unleashing of the full healthcare power of Unani medicine. I've just said that the Unani potential, hardly 5% of it is being used, because Unani medicine is being wrongly interpreted. It is being distorted by being understood in the framework of positivist and materialist philosophy and worldview. So when we have the proper worldview and we study Unani medicine in that proper worldview, then we will be able to activate and unleash the full potentiality of Unani medicine. Nowadays, we are hardly using 2% of it. This is the lower problem solving benefit. And the higher benefit is that it will restore in integral learning. Recently, I sent my submissions to one Christian priest who is also a PhD in Christian theology and Christian philosophy. And he was so much, he focused totally on Unani medicine. I had mentioned many points in Islamic philosophy, but he focused only on Unani medicine. He said, this is really wonderful. By means of Unani medicine, we can show that supramaterial reality and ability of intellectual intuition to know the supramaterial reality. This is proved by Unani medicine, because the treatments which are hypothesized on the basis of these schemes, they work. So in this way, I mean, it is a very wonderful thing that studying Unani medicine will help to restore what I have called integral learning. Integral learning means a study and understanding of the entire reality, from the physical or the corporeal level right up to the divine level. So it will, studying the philosophy of Unani medicine, and I think you have the clear example. There is the Quwwat. The Quwwat is an instrument of Tabiyat. The Tabiyat is an instrument of the spirit, and the spirit is the instrument of God with relation to man and his physiology and his body. So in this way, we can understand what a great role the study of the philosophy of Unani medicine and the study of Unani medicine in general, in the light of or in the framework of its proper philosophy, it will help. The higher benefit would be that it will help in the restoration of integral learning. These are things which we have discussed in our basic document, which is the FICA resolutions. Unfortunately, I could not send it as an attachment to the hosts, but I'll send it later on, and I'll request them to please share it with the participants. So these are things which we have discussed in our basic document, which we call FICA resolution. So these are the two benefits of Unani medicine, studying Unani medicine with the correct understanding of its philosophy. First, it will help us to unleash the full potential of Unani medicine in healthcare. And secondly, it will help us in much more greater and larger task of restoring integral learning in society, in academic institutions, etc. These are things, this idea of lower benefit and higher benefit has been discussed in our basic document of FICA resolutions. May I have the next slide, please? Now, this is again a very interesting point. Muslims are such, I mean, early Muslims have demonstrated such nobility of character that they practice this medicine as Unani medicine. They have given it the name of Unani medicine. In the classical period, it was simply called tib, or the medicine. But when other medicines arose, like modern medicine, or when they came across Ayurveda, and then there was a need to have a name for the thing which they considered as the medicine, or al-tib, at-tib, then they gave it the name of tibbe Unani, or Greek medicine. Whereas the fact is that, no doubt, the Greek medicine is a very great thing, but it is also equally true that the Muslims, they at least updated it 10 times, if not 100 times. And the present day Greek medicine which we have, the Islamic civilization has made a great contribution to it, and it has actually protected it from being denied and refuted, as it was in Europe, as it was denied in Europe, paving the way for the arising of modern medicine. So that could have happened in the East also, but it was protected. And it was not only protected, it was completed and it was refined. So this great task of protecting the Greek medicine, ancient Greek medicine, and of refining and perfecting it, this was done in the Islamic phase of the history of Greek medicine. Now, both the ancient Greece and ancient Greek tradition and the Islamic tradition, they are traditional. So you must have heard this term so many times that now the time has come to define what we mean by traditional. By traditional, we mean any civilization based on a particular revelation and religion. But of course, developing a philosophy also, and then developing very systematic sciences, but ultimately based upon a revelation and religion. So in this way, we have a Hindu tradition, we have an Islamic tradition, we have a Taoist tradition, we have a Christian tradition, we have a Buddhist tradition, so on and so forth. So by tradition is meant a civilization which is based upon a particular revelation and religion. But of course, it does not do everything only by the religion itself or by the theological sciences. Rather, it develops a philosophy, and then it develops very clear sciences. But ultimately, its philosophy and sciences are based upon its revelation and its religion. So because the ancient Greek tradition and the Islamic tradition, they are both traditional in the sense that they are both based upon revelation and intellectual intuition. So it was easy for the Muslims to take Greek medicine. Now, usually the Western scholars, it's very painful, their malafide intentions or misunderstanding, whatever it is, I cannot judge that. But it is very painful that they make it out that whatever scientific greatness and originality and power was shown by Islamic civilization, it was because of the secular persons within the civilization. The religious persons always opposed the science. Nothing could be farther from truth. The Muslims came across books on Greek medicine during the reign of Umar bin Abdul Aziz, who was a very orthodox person, so much so that he is called the fifth Khalifa Rashid. So when Umar bin Abdul Aziz was told about these books, he was actually, it was a new thing for him. That knowledge was new type of thing for him, and he was not sure whether it is correct or it is false, whether it would be beneficial or harmful. So he performed istikhara. For 40 days he performed istikhara. That means seeking guidance from God after prayer, and kept these books under his janamas, under his prayer carpet. And then he reached the conclusion that this is useful and it should be disseminated throughout the Islamic kingdom. So it is the orthodox persons who are totally motivated by Islamic revelation and religion who welcomed Greek medicine and who disseminated Greek medicine in their kingdom. Here there is a very interesting question that Muslims had come across even Indian medicine. They had come across even Chinese medicine. Why they used Greek medicine as the basis of their medicine rather than using Indian medicine or other medicine? This is a very interesting question, but I'll leave you with it because this is a very intricate issue and it will take much time. But Greek basis is in the time of Galen himself, very early in the history of Greek medicine, some anatomical discoveries were made that women also have gonads. They have ovaries, which are counterpart of the testes of the males. Whereas Aristotle had said that the gonads are present only in the male, and it is the male who determines the character of the child and the progeny, because he only has the gonads, because at the time of Aristotle, ovaries had not been discovered. So this shook the Greek medicine, and it was nearly on the verge of a total collapse, and then being inundated by that very reductionist and partial and molecule-based medicine, which we know to be the modern medicine. It was very close to it. And this is what a bit later happened in Europe, but in the Islamic world, this did not happen because Ibn Sina arose. Ibn Sina then made a great contribution, and he said that the father determines the form of the fetus, where the mother provides the substance of the fetus. So that way, he reconciled the discovery of female gonads with the principle of Aristotle that it is the father who determines the primary characters of the child. So from this example, this example has been mentioned in the Iranian encyclopedia under the title of Avicenna. So in the light of this example, we can understand that what is the great contribution, what tremendously great contribution is there of the Islamic civilization in preserving Greek medicine, and then of course in expanding it. Now the question arises: what characters of the Islamic tradition they helped the original Greek medicine to develop, if not 100 times, at least 10 times. So it is basically two things. Firstly, the Tawheed, the religious teaching or theological teaching of Tawheed in Islam, which is, as all of us know, unity, and the genius of Ibn Sina, Avicennan genius, and other great scholars, their talent, which were behind the defending of ancient Greek medicine and the expansion and perfection of ancient Greek medicine. So the interesting thing is that nowadays some Europeans are trying to restore Greek medicine in Europe, and one of them, Dr. Barry Oldham, has set up a Greek medicine institute in Athens, in Greece. But he has given it the name of the center of Tib. Tib is the actual word which he uses. And his curriculum is based not on the books of Hippocrates and Galen, which are available even now, and their English translations are available. Some of them have been translated into Urdu also, and of course, all of them had been translated into Arabic 1400 years back. So instead of basing his curriculum on the books of Galen and Hippocrates, he based them on Al-Qanun of Ibn Sina. So this is a contemporary experience which shows that the Islamic civilization made a tremendous contribution to the original Greek medicine and advanced it, if not 100 times, at least 10 times. May I have the next, please? Next slide, please. This I've discussed. The next one. The next. Yeah. Can we go to the previous slide? Yeah. Right. This we have discussed. Please move ahead. Yes. Now, there are many traditional philosophies in the world, and they are very great, and they are really remarkable and wonderful. And some of them are especially powerful in some respects. We have the Hindu philosophy, we have the Islamic traditional philosophy, the Taoist, and so on and so forth. But a very eminent Hindu metaphysician, we can say the greatest contemporary Hindu metaphysician, Ananda Kumaraswamy, has mentioned that Islamic philosophy mediates between the Eastern and the Western approach. So this shows the uniqueness of Islamic philosophy vis-a-vis other traditional philosophies. And this is one basic reason why Greek medicine, the original ancient Greek medicine, developed 100 times when it came in the hands of Muslims, because the Islamic philosophy is very unique, is very distinct. One of the distinctions being that it is very universal. It mediates between the East and West. That is the comment of Ananda Kumaraswamy. So Islamic philosophy is a truly universal philosophy. And that is why Islamic philosophy has, on the one hand, it has laid the ground for the emergence of the greatest explanation of the Vedas, which is called Advait by Shankar, on the one hand, and Tarachand, a very great noted historian, Tarachand, in his classic titled The Influence of Islam on Indian Culture, he has mentioned that it was the Islamic teachings, particularly Sufism, which was the catalysis behind this particular explanation of the Vedas, which is called Advait. And on the other hand, another eminent scholar of the West, he's our contemporary, working in the Thomas Aquinas University in USA, Hauser. So Hauser has mentioned that Thomas Aquinas, who is the greatest theologian of Roman Catholic theology, he synthesized Christian theology with Aristotelian philosophy. But that's the point which Hauser makes. It was an Aristotelian philosophy which was Avicennan, because there is a pre-Ibn Sina Aristotle and then there is a post-Ibn Sina Aristotle. So Thomas Aquinas, one of the two great Christian theologians, the first one was Saint Augustine. So these Thomas Aquinas was influenced by Aristotle, but that Aristotle who had been developed and interpreted and refined by Ibn Sina. So on the one hand, Islamic culture gave rise to catalyze the emergence of Advaita in Hinduism in India. And on the other side, it gave rise to the development of Christian theology in Europe. Nothing is by accident. So what are the causes behind it? So the causes behind it is the two very important and fundamental causes behind it are: number one, Tawheed. Insistence upon Tawheed. Tawheed is something which is accepted by everyone, but making that center stage, making that be and end all, making it very consistent, truly consistent, fully consistent with all the other things in the religion and philosophy. This is the characteristic feature of Islam, Tawheed, unity. And this Tawheed is a plenitudinous unity. It is not a unity which is monochromatic of one color. It is a in our language we say that wahdat mein kasrat, multiplicity within the unity. So Tawheed in Islam is a wahdat mein kasrat, and this is clearly proved by the use of God's name Samad in Surah Ikhlas. Qul huwallahu ahad, Allahu Samad. Samad means the one who is the basis of the countless. This is the meaning of Samad, the one who is the basis of the countless. So this centrality to a plenitudinous unity or Tawheed, this is one thing which helped and guided and instigated the Muslim scholars to do such a great service to original ancient Greek medicine. And the other thing is ghaib, the very great importance to the supramaterial reality, insistence that supramaterial reality is there. The reality is not only material, rather the supramaterial is the more important thing, as many of us know that the Quran makes it a condition for guidance, that this holy book guides only those allazina yuminuna bil ghaib, those who believe in the ghaib, in the supramaterial. So I think that it is these two teachings of Islam, that is Tawheed, which is a plenitudinous unity, as reflected by the sifat and name of God Samad in Surah Ikhlas, and the great importance which is ghaib, so much so that believing in ghaib is made the condition for benefiting from the Quran, and thereby making the idea of supramaterial very strong. These are the things which help the Muslims to not only defend ancient Greek medicine, but to take it ahead. Next, please. May I have the next slide, please? Now, other traditional medicines are organized totally on analogous principles, but of course, the schemes are different, but the essence is the same. So we can say that all the traditional medicines, they are supported by each other at the essential level, but as far as their overall forms are concerned, they are very specific. And these medicines can be practiced only if they are practiced on the basis of their specific forms. But as far as their essence is concerned, it is totally similar. For example, we have talked of 5 divine presences. In Ayurveda, they talk of 5 koshas. Annamaya kosh, which is the material level, Pranamaya kosh, which is the subtle level, Manomaya kosh, which is another aspect of subtle level, then Gyanmaya kosh, which is a spiritual level, and then there is the Anandamaya kosh, which we can consider to be the divine roots, which we can consider to correspond to the Hahut. And then in Ayurveda, there is the talk of Sthul Sharir and Sukshma Sharir. Human beings have got a gross body and they have got a subtle body. So this subtle is again the same, which is called Malkut. And then there is the teaching of Prana, that every human being has got a subtle force, a subtle substance, which is called Prana. This corresponds to the Arva. And then, as we have already seen, that in traditional Chinese medicine, the very basis of medicine and physiology and pathology is that there is a subtle force called qi, which flows, which has got vessels through which it flows. And when these vessels get blocked in certain parts, then some corresponding diseases arise. So this makes it clear that all the traditional medicines, they are essentially the same, but their forms are very specific and they can be practiced only on the basis of their specific forms. However, they can get support from each other at the essential level. Next, please. Next slide. Yes. So now we can come to the conclusions. The first conclusion is, and most basic conclusion is, and very categorical conclusion is, that Unani medicine and all other traditional medicines should be studied in the context of their tradition, which includes their revelation, their religion, and their metaphysics. Only then they can be understood correctly, and only when they will be understood correctly, their practical potential will be unleashed to the full. Otherwise, if they are studied in the context of modern Western positivist worldview and philosophy, then there'll be horrible misinterpretations like equating the ruh with the oxygen, etc., such absurd things, and it will be totally subverted, and people will be left only to treating diseases by following some old prescriptions. They will not be able to treat the diseases systematically because they would have lost all correct knowledge and understanding of the physiology and pathology of Unani medicine and other traditional medicines, because they are supramaterial based, and in the present day they have been distorted and wrongly interpreted in the material way. So the first thing is that we have to study Unani medicine in the context of Islamic tradition, in the context of Quran, in the context of Hadith, Sunnah, and in the context of traditional Islamic philosophy, the philosophy of Ibn Sina, mainly the philosophy of Ibn Sina. It has to be studied in that context. Only then it can be, its teachings can be correctly understood. And only when its teachings are correctly understood, its practical potential can be unleashed in the full. Then the second conclusion which we can make is this, that the traditional philosophies itself, in whose context we have to study Unani medicine, those traditional philosophies should be restated so that they become more comprehensible for the complementary mind, for the contemporary mind, because the contemporary mind has been shaped and fashioned by so many things, and the traditional philosophies have not to be changed, but they have to be restated. Then the traditional philosophies should be correlated with other traditional philosophies, and then they should be engaged with modernity. Modernity, both in its dimension of the modern positivist philosophy, as well as modern sciences and various modern issues, modern natural sciences, modern social sciences, etc. So then it should be engaged with modernity. And then the third thing is that the traditional philosophies should be restored to the academia. Fortunately, we have the traditional philosophies, at least in India. We have Islamic philosophy in certain departments, certain universities. We have the Hindu philosophy and other systems. This should be done on a more systematic manner by the proper understanding of the traditional philosophies. So the traditional philosophies should be restored to the academia. And then the moderns, they should be used as the basis for an integral learning, for a learning which describes the whole reality from the material up to the divine. And within that integral learning, the modern sciences should be integrated. This is a well-known dictum of metaphysics, that true metaphysics has got a place for everything, because whatever exists could not exist if there was not one element of truth in it. So a true metaphysics will have the place for that element of truth, even in a system which is 90% wrong, but it will have some element of truth. So a metaphysics must have a place for everything, but the other part is much more difficult to achieve. And everything in its place. That's very important. Everything should be put in its place. Some is high, some is low, some is partial, some is complete. So it is in that sense that modern sciences, natural sciences and social sciences should be integrated in the integral learning, which is the learning and description and intellectual and systematic description of entire reality from the material to the divine. In that integral learning, the modern sciences should be integrated in the sense that they should be put in their proper place within this overall learning of the overall multi-level reality. And then the last thing is that it should be this restored integral learning and the integration of the modern science in it. This should be used as a basis for optimizing both the learning, which is present these days, as well as policy making, both the intellectual aspect, excuse me, as well as the practical aspects, policy making, which the policies which govern the civilization. Then, of course, this is very clear that it should affect the healthcare policy also. And with regard to healthcare policy, we can say that we have talked that a study of Unani medicine has a higher benefit. It helps in restoration of integral learning, but it has a lower benefit also. It helps in problem solving the problem of healthcare. So at the healthcare level, the guidance which we can take from this study is that we should integrate modern medicine and Unani medicine at the healthcare delivery level, not at the level of ideas and schemes and teaching and education, but at the healthcare delivery level, which means that a person should be treated by in every dispensary, in every hospital, there should be a modern medicine doctor also and a Unani tabib also. And both of them should contribute their part to the healthcare of that person. So this is what we mean by the fact that these two systems should be integrated at the level of healthcare delivery. And the two basic rules of this integration is that for simple diseases, most of the diseases, we should use Unani medicine. But in serious diseases or serious phases of diseases, in medical emergencies, in crises, we should use modern medicine, because modern medicine is very powerful, number one. Number two, in many cases, a combination of both can be used because they do not have any intrinsic antipathy to each other. It is possible to use them. And nowadays, a lot of work is being done on giving those Unani drugs to a tuberculosis patient, to a patient of TB, which can protect his or her liver and other systems from the serious toxic effects of anti-TB drugs. So there's a lot of research these days for combining for example, in TB, on the one hand, from modern medicine, the antibiotics are being given, and on the other hand, from Unani medicine, those drugs are being given which protect the liver, etc., from the very devastating toxic effects of the antibiotics. This is being attempted in the therapy of cancer also, and I think those of us who have gotten a painful experience of having a relative suffering from cancer, we note that the treatment of cancer produces very serious toxic effects. All the hair, they drop. There is a bone marrow suppression, very severe anemia is there, and so many other problems arise by the use of anti-cancer drugs. So we can take anti-cancer drugs from the modern medicine, but we can take drugs from the Unani medicine, which can prevent these awful adverse effects and side effects of the anti-cancer drugs. And the third, so in healthcare policy, they should be integrated at the level of healthcare delivery, either by giving this or that medicine. In simple case, in ordinary diseases, Unani. in severe cases, modern medicine, or a combination can also be given. And then the next point is that these medicines should be studied and practiced independently in the light of perspectival differences. We should not try to make Unani medicine a caricature of modern medicine. Neither we should try to make modern medicine a clone of Unani medicine, which of course no one is trying to do. It is only the first thing which is being done with a great deal of zeal, misguided zeal. But this is very wrong. As we have already seen, they have very different perspectives. So they can deliver their best only when Unani medicine and modern medicine are studied in their proper perspectives. The rest of my slides are not properly a part of this talk. One of them shows the topics for the next lecture, and then the other one shows the bibliography. I think that is a bit more relevant, the last slide. Bibliography. I've already talked of Alman, the author of Islamic medicine, who has said that the arkan are abstract things. Then another very good book is by Usman Bakar, Tawheed and Science, in which there is a very good article on Islamic medicine, Usman Bakar. Islamic medicine is another word for Unani medicine. Then, of course, we have Shuon, Dimensions of Islam, and the article on 5 divine presences. Then we have the Fiqh resolutions, which I've said is our basic document. And then there's another very good book. Unfortunately, it is difficult to get. Only in few libraries it's present. It is Theories and Philosophies of Medicine. It was published by Hamdard University a long time back. So that's also, it has got some very good articles on Unani medicine, but on Ayurveda, alchemy, and Chinese medicine also. So this, I believe, is a good bibliography for getting a proper understanding of Unani medicine. Thank you very much. Now I think we can have our discussion and questions and answers.
Thank you very much, Dr. Yusuf Amin, for your valuable time and all the efforts you put in creating this presentation. And I hope everyone enjoyed the lecture, and I'm confident benefited from it. And as Dr. Yusuf Amin mentioned, so if you enjoyed it, which I suppose you did, please be ready for the second lecture that we are going to have, inshallah, because this lecture was supposed to be to lay a foundation for something that we are planning to do in another lecture. That is, because this may come to your mind that Unani, for example, as Dr. Yusumin mentioned, considers 4 types of mizaj: the hot, cold, and the dry and wet. And on the other side, the modern medicine has totally different kinds of theories for disease, the germ theories and other. And how can germ theory, if germ theory treats a disease, how can Unani medicine, which believes in a different reality, treat that? Or if Unani medicine treats it, how can modern medicine, which has a totally different theory of disease and of medicine, treat it? So this kind of raises a question about the perspective of reality. What perspective of reality we should have, and what is the right way to look at reality? Is it relative? Is it subjective? Is it objective? We will be discussing the implications of this, and taking the talk further of the comparison of Unani and modern medicine to its implications on metaphysics and on reality. And one of the key points that I would like to mention is about maratib, or the hierarchy, or multi-levelness of reality that Dr. Yusumin mentioned. It's a very important concept in Islamic thought, not only in ontology, being in maratib al-wujud, in epistemology, maratib al-ilm, where we have the sense experience, reason, and revelation, and subjective sources of knowledge, which may include intuition, as was mentioned by Dr. Yusuf Amin. Moreover, maratib of akhlaq and in other realms. What I mean is maratib is a very important concept in Islamic philosophy and Islamic thought. And going forward, I suggest that everyone should try to get a better understanding of this. And I would like now to open the stage for questions. You can write, if you have any questions, you can write them in the chat box. And I would suggest please try to be brief so that we can take more questions. We have a couple of questions here from Miss Sarah Arman from Turkey, I guess. First question is, wasn't Unani medicine the scientific medicine of the past, just as modern medicine is scientific medicine today? The second question is a bit different, so I will take them separately.
As a question, it is in this sense, it's a good question that it helps us to understand things. I think the entire tenor of this talk was to show and to substantiate the fact that the relation of these two medicines is not that of old and new. Of course, there is an aspect of old and new also. Like Joshandas were prepared by the patients themselves, and nowadays some people have converted them into sort of tea bags, but in which they can be, we can prepare Joshandas by tea bags. So this type of relation is there, old and new. That relation is there, but that's very minor and that very inconsequential. The real relation is of two different perspectives. Unani medicine and other traditional medicines, they treat man at his holistic level, where he is actually unified, and he is actually unified only at the supramaterial level. And they access the states of the supramaterial level by means of certain sensory signs. And then they use holistic drugs, natural products like minerals or plants or animal parts. They are not synthetic molecules. So even the treatments are holistic, and the disease is conceived and studied in a holistic manner. The basic imbalance behind the disease is searched for, and that is corrected. Of course, symptomatic treatment is also given. So this is a holistic perspective. On the other hand, the Western medicine has got a partial perspective. It only looks at the summation of the symptoms of a disease. And then it finds out the molecule and the derangement of the function of the molecule behind a particular symptom, and then its correction by giving another molecule. For example, in the case of hypertension, giving drugs like prazosin, which is basically a blocker of the alpha adrenoceptor. And when the alpha adrenoceptor will be blocked, then the vasoconstriction will be relieved and the blood vessel artery will widen up, and then the resistance will go down and blood pressure will decrease. So Western medicine has got conceives disease only as a summation of its symptoms, and then it finds out the molecule and molecular derangement behind each system and corrects it by giving another molecule which somehow patches up that derangement of the molecule. So these are very different perspectives. So and at a very layman level, we can say that that's why WHO has accepts all traditional medicines as very significant components of healthcare. If it were only a matter of old and new, what would be the use of just for sentimental reasons having the old things when we have much better things to do? So it is not a matter of old and new. The WHO also recognizes it. In fact, in one of its recent monographs, the WHO has said that this multiple drug resistance, which is occurring in the case of TB, the TB, the antibiotics, they develop resistance. So the people gave 3 or 4 antibiotics together. And that worked for many years, many decades. But now the mycobacteria is developing resistance even against multiple drugs. And this is a very serious problem, and which means only death for hundreds of thousands of people who are suffering from tuberculosis. So WHO is very much concerned with it. And in the polygraph, it has mentioned that we should develop a new approach, not only of discovering new antibiotics, which we should continue to do, but we should try to develop immunomodulators, drugs which strengthen the immunity of man, so that the body itself can fight against the mycobacterium. And then it has gone on to say that such drugs are more likely to be found in traditional medicines. So this clearly shows that traditional medicines they have something to do which the modern medicine cannot do. And their basic relationship is not of old and new. That is a partial relationship, I agree. But the basic relationship is of two very different perspectives. One is a holistic perspective and other is a partial perspective.
Another question by the same guest is, you mentioned that new diseases like corona are also explained by humor imbalance. Don't epidemics have a separate category in Unani medicine?
At a secondary level, Unani medicine does have an idea of diseases where ajsam khabisa, it calls them ajsam khabisa, corrupt bodies, may be an important factor in the production of the disease, and accordingly their characters would be useful. But this comes up at a tertiary and a quaternary level. The basic thing is that behind every disease there will be a fundamental imbalance of the four qualities, and that should be corrected for fully eradicating the disease. Then at a secondary level, the fact that some ajsam khabisa are involved, that should require that we must add some drugs to those basic drugs which are correcting the imbalance, basic imbalance. To those drugs, we should add drugs which act against the ajsam khabisa also. So yes, Unani medicine is a very sophisticated system. Things are not, it begins with what I've tried to present today. It does not end over there. And this will, make me relevant for at least a year for you. Many lectures, at least about 24 lectures may be needed for getting even a modicum of full practical idea of what Unani medicine says. So you are right that Unani medicine recognizes diseases where at a secondary level, the ajsam khabisa have a role to play, and they may be mutaaddi or contagious, which require some lifestyle interventions like staying away from each other, etc. So these things are there, but they come at a secondary level. Basic thing is that every disease will have a basic imbalance in which one of the qualities has abnormally increased. And unless the correction is done at that level, corrections at the secondary levels are not going to go the whole way.
There is a question by Mr. Cal Trelor. Is intellectual insight or inspiration of the sage a sign of complete health? Can we hope for some level of intellectual insight from a patient and do connections to other entities in the Malakut, Jabarut, etc. establish disease?
You see, unless we take a very maximalist idea of health, which practically makes it meaningless, this is not so. By health, if we take the usual things by health, then that does not have a very important role to play in the exceptional abilities of the sages. It's a matter of consciousness. This issue also has been discussed in traditional philosophy, in all traditional philosophies. Only yesterday I was reading Shah Waliullah, where he has mentioned that human personality has got two dimensions, an animal nature and an angelic nature. And sometimes they are in concordance and sometimes they are in contention. So this makes up many types of human beings. So he has said that those persons who have got a very high level of angelic nature and a very high level of animal nature, and it is contentious, yet they keep the animal nature under the control of the angelic nature, yet they do it. They are the persons who are the which he calls mutallihun, which is translated as theosophs, like the illuminationist philosophers and like the Gnostic philosophers, Sheikh Akbar ibn Arabi rahmatullah alayh. So these are the people. So we have discussions on what are the real things which make a person an exceptional sage. So it boils down to the fact that it has got two components. One is nature, one is nurture, but one is a particular talent which is God given. And then, of course, there is another dimension is a practice and discipline, which go together to make a sage. But I think this health in the usual sense, it does not have, it is not so basic to the emergence of an exceptional consciousness which we see in a sage.
Thank you. We have take a last question from Mr. Nasir Hussain. How do you look at future of Unani medicine when modern medicine is taking great strides in gene cloning, DNA recombinant technology, stem cell technology, AI in curing and diagnosis of diseases?
Firstly, I'll look at it from the positive side. From the positive side, I've already submitted that modern Western quantitative science, its distinction is exactitude at the intellectual level and at the practical level, power. This is something positive. We should welcome it. But as we have shown in our basic document, FICA resolutions, exactitude has been obtained by sacrificing a big part of reality. In other words, a big part of holism. So the contribution of modern medicine or Western medicine is something new. Very powerful treatments are there, but these powerful treatments are very dangerous, as we have just seen the case of treatment of cancer. So it is positive, but it will be prudent to use it only in medical emergencies. By default, the treatment should be Unani medicine or other traditional medicines. So on the positive side, we welcome it. And despite their adverse effects, because in Urdu we have a proverb, marta kya na karta. When a person is dying, he will do everything. He will take the worst poisons if they can help his or her life to be saved. So that Western medicine, if it is able to do even better by the even more potent stem cells, we welcome it. But then it should be restricted only to the treatment of very serious emergencies where other treatments are not possible, because, and that also not because out of sentimental reasons, but because of very logical reasons, rational reasons, that they are very dangerous. All these things about which you talked, as a person who has a basic training in MBBS and MD, and who has been a professor in pharmacology for about 40 years. I mean, I know that these drugs which are called biologicals, they have got so much serious side effects, and the worst part is that much of it is even not known. We cannot say that these are the only side effects which they have. So the restriction in their use is not sentimental, but it is logical and rational. So that's what I would like to say. And because the great pyramid of healthcare, where Marta Kya Karta is not the situation where the person is not dying, there, of course, it is the traditional medicines which will survive and which will progress. And this is my experience. I mean, I know hundreds of such cases there, but I don't have the time to recount that how the Unani medicine is spreading, and it's being welcomed in USA and Europe, and by the most educated persons, and they are getting very good results out of it. When I saw the picture of Prince William's wife after her first child she had, she suffered from morning sickness, and for which morning sickness is nausea, severe nausea, which some ladies develop when they are pregnant, when they are expecting. So she was hospitalized. And when she came out of the hospital, the picture was there, oh, there were black circles around her eyes and she was half dead. And I thought that if only she would have known one simple Unani drug called Jawarish, she would have been full of laughter and blooming at that time. My wife also suffered from the same problem in the case of our first child. She was half dead, but then later on, my Unani colleagues, because I'm basically a modern medicine person by training, but informally, of course, I study a lot of Unani. So one of my Unani colleagues then recommended Jawarish, and in the case of our second child, she was hale and hearty throughout the pregnancy. So in the large area of healthcare, where the situation is not do or die, there Unani medicine and other traditional medicines, they have got a wonderful role, which is being increasingly recognized and which people should be helped to recognize.
Maybe
But
we
of
can
course,
have,
they should also be helped in, clearly it must be mentioned that when it comes to serious diseases, they should unhesitatingly take the modern medicine treatments.
maybe we should develop a theory of maratibul ilaj for different states of on the basis of severity and what treatment and what
You
theory
are
should be used.
you are right, Mr. Modis, you are right that this hierarchy, this has got a very basic place in traditional learning, and much more so in Islamic learning. So much so that adab is putting a thing in the right place. That is adab. So in this way we can talk of hierarchy, but I sometimes feel that when we extend a thing too much out of its conventional areas, then it is not left with much meaning. So we should recognize that hierarchy is a very general principle. It is a very general principle which is well recognized by traditional philosophy, particularly Islamic traditional philosophy, and which has been totally forgotten by Western learning, and it must be relearned by them. So hierarchy is a very important principle. But I think to use this term and equate it with the levels of being and levels of consciousness uh, uh, may make things a bit so that's my opinion, that we must use this word hierarchy technically with the levels of being and levels of consciousness. There, they have a very good psychological and pedagogical role using hierarchy as a term. But at the same time, we should recognize that hierarchy is a very general principle and it has application in ilaj also, in treatment also. You are right. And what I suggested as a rule of thumb for healthcare policy, that was basically a sort of invoking a sort of hierarchy. But I think the term hierarchy should be used mainly in the context of ontology and epistemology, or in the context of levels of being and levels of consciousness.
Thank you once again for your time, and we took a lot of it. And for the questions
Maybe.
also were well answered. And I don't think anything else remains for us. And I thank all the audience for staying with us. And I really appreciate the interest they have shown in the topic and stayed with us all the while. So I once again thank the speaker and the listeners, everyone, for being with us. Yes, please.
May I take
Yes,
1 minute?
yes, please.
Firstly, I'm waiting for the second lecture, inshallah, and I hope the delegates found it useful enough to be present in that one also, and maybe kind enough to mention it to some of their friends and colleagues. And secondly, I want to very much thank I want to, yes, I want to very much thank my young friend Wasim Malik. He's a PhD scholar in Islamic studies, and he's very savvy with all this setup, laptop and Zoom and everything. So I requested him to come here, and he very kindly came, and he took my mind off these technical problems, so I could totally concentrate on the talk. So I thank him very much, and I acknowledge his help. That's all.
We thank Mr. Wasim also for helping Dr. Yusuf Amin so that we could have this talk and all. And for future communication, I request all the guests, if you could subscribe to our Facebook or Twitter, or join the Telegram channel so that you can be updated about the future programs and the second part of this lecture, which we plan inshallah soon. And also the recording of this lecture will be uploaded to our YouTube channel after it's edited and all. And once again, I thank you all for being with us. And may Allah give us tawfiq to see the truth as it is and increase our knowledge, beneficial knowledge. Assalamu alaikum wa rahmatullah.
I thank the organizers and all the friends who participated. Assalamu alaikum.